How do we plan and complete a cosmetic case using porcelain veneers? Well, on some of the other videos, and you probably know, is that we always offer complimentary discussion visits so patients can get an idea of what the options are for them, but also the costs. Once they've decided on that and they come in for the consultation, you know that we take a lot of photos, videos, and we do what we call digital cloning, where we get as much information as we can about the patient so that we can plan their case. And that includes digital smile design, it could be models of their mouth, it could be 3D bone scans. There's a number of things that we would use in order to 3D clone the patient. That first visit only takes around about an hour, so it's been half an hour to an hour for us to gather all that information. What the patients don't see is what happens after the hour. Models will go down to the technician and I will sit down in front of the computer for around about an hour and a half to plan the case. And what that means is that we plan it through digital smile design, which means that we're stepping back from the patient and having a look at their face and building their new smile according to certain parameters within their face to make sure that the final smile looks right. We then walk a bit closer and we look at the lip support and really looking at the position of these teeth to see whether the patient needs fuller lips. Secondly, from there is we go even closer to the patient and we look at each individual teeth. And all of this design process on the computer for us to go through from taking the photo or loading the photo all the way through to getting a mock-up, a digital mock-up of what that patient is going to look like, probably takes around about an hour and a half. I give that mock-up to Libby. And Libby, our technician on site, what she does is she will then start to design the teeth. For her to wax up a case in wax can take sometimes 5 to 6 hours. So she'll spend a lot of time looking at photographs, looking at my smile design, and actually planning the case. So that porcelain or that porcelain mock-up that we're doing, that trial smile we're doing, takes a lot of time. And the reason why we need to take a lot of time is if we do all of this treatment early on, as in make sure that this is correct, it means that the final result in porcelain is going to be perfect. So that trial smile actually is shown to the patients. The patients will come in and they'll get to see this mock-up of their wax up or this trial smile on a model. If the patient is happy with that model, of course they will book in to get treatment done, and whether they get it done awake or asleep, what happens is they will walk out with a trial smile. This trial smile is critical because we ask the patient to give us as much feedback as possible. Are they happy with the shape, the colour, the position, the phonetics of these teeth? And we really want as much feedback from them so that we can do adjustments. If we can adjust these teeth and they're actually perfect for the patient, we know the final porcelain will be fine. With the final porcelain, Libby will take probably about 2 to 4 hours per porcelain tooth to actually create a beautiful smile. This is all very, very fine work, and it really takes patience and an artist to create such beautiful teeth. And you have to remember, this is the new tooth enamel for the patient, and she will spend hours just staining and glazing and making sure that the colour of these teeth and the shape and the position of these teeth are actually perfect. The patient won't see a lot of this work happening, but they will come back for the insert visit, and usually when we bond the new porcelain in, it's probably a visit that will take a few hours to do, maybe 2 to 3 hours if we're doing, say, 10 teeth. But the results that we get are always as ideal as we can because we take all of these steps from the beginning all the way through to ensuring that the final porcelain and the final smile is beautiful.